the Dr. Ardis Show. I'm your host, Dr. Brian Ardis, and this presentation is all about heart damage. This is being filmed in February of 2023, which just happens to be every year, February Heart Health Awareness Month, or National Heart Health Awareness Month. Whatever you want to call it, it's all about hearts. Well, there's a bunch of hearts that are being injured, damaged, and diseased throughout the entire world during the last 3 years, intentionally behind the COVID-19 narrative and with the vaccines. So we're going to actually ask that you share this presentation with everybody you love. We're going to be giving you information about how prevalent heart disease is related to long haulers, COVID, the vaxxed injured. We're going to be giving you data, research topics. We're going to be giving you hyperlinks to those papers and publications if you want to use them and share them. And then we're going to wrap up the presentation with what drugs you need to know about and what kind of side effects those might have in relationship to heart disease and as they're being prescribed, and what the alternative published all natural resources that work and don't have the same side effects you might want to implement into your life and discuss with your physician and loved ones to consider adding to your regimen to improve your heart health. You only got one heart, you only got one life, and it only lives as long as that thing's living. So let's see how long we can keep this thing ticking as God created it to. All right, let's get into this presentation. We're very excited about this. All right, so first slide, we're going to talk about long COVID. There's about 200 symptoms associated with COVID-19 and with long hauler COVID symptoms. And worldwide, there's about 65 million, they estimate, that are living with long hauler COVID symptoms, which can include anything from postural changes in your blood pressure, dropping, going from a seated or standing position, laying down, standing position. That is actually an acronym called POTS. There's actually changes in your stance, in your position, moving your head right and left, and you'll get dizzy and vertigo. These are actually signs or symptoms of blood pressure is affected, heart's affected. We've seen prolonged or elongated periods of time of QT or QR intervals of the heart's beat that are actually getting longer than they should be. That means the heart's having to work harder and slower at pumping your blood. These are all side effects published by heart institutions around the world. All right. Myocarditis, you've heard a lot about this. Never before did you ever hear about this, and most cardiologists on the planet agree, Dr. Thomas Levy, Dr. Peter McCullough, that they rarely ever saw this in their multiple decades as cardiologists, and now almost everybody knows someone who has myocarditis. All right, myocarditis, by definition, we've talked about this before. We've done presentations at 10 for 10 with Thomas E. Levy on how to reverse myocarditis, but as a review for those who haven't seen those presentations and for those who are going to receive this presentation for the first time ever, myocarditis is Latin for myo means heart, carditis means inflammation of heart muscle, myo means muscle, carda means heart, itis means inflammation. So it literally reads inflammation of heart muscle. And that reduces, when you have inflammation of the heart, the ability to pump blood throughout the body, which is less oxygen to the body, less nutrients being delivered to the body. And this is a reason, as listed here on this slide, behind 45% of all heart transplants is myocarditis. Never before in the history of human beings on this planet have we seen as many teenagers being diagnosed with myocarditis as we do now within 7 days of getting their second mRNA COVID-19 shot. And that is published by the CDC, and it's on their website. We reviewed that and shared that with legislators all over this country, personally and in person. Pericarditis, around your heart is a layer of tissue called the pericardium. Para means around, so it's around the heart. And inflammation of the pericardium is called pericarditis. And as you see there, you'll see the definition. A sac-like structure with two thin layers of tissue that surround the heart to hold it in place and help it work. Endocarditis, inflammation of the inner lining of your heart, is also something that has been published in a book by Thomas E. Levy in the book called Toxic Tooth. And we already discussed here multiple times on our platforms with Dr. E. Levy, the cardiologist, that there are infections underneath the teeth that can actually drain directly to the heart and lead to endocarditis, which can lead to death ultimately. Which is why if you see a fever and a high blood pressure in a patient with an infection under a tooth, a dentist will send you home and go on antibiotics before they do any procedures on you. They're worried about the infection traveling to the inner lining of your heart and leading to an endocarditis event, which can cause death. And you'll see there, SADS, or sudden adult death syndrome, is a new term we've heard now in this last year after the COVID-19 shots have gone out. To the left, you'll see a full graph of different symptoms that are related to the initial infection, long hauler COVID symptoms, and then what they call breakthrough infections, which breakthrough infection is a term they use in relationship to the vaccines, that if you got the vaccine and still got COVID after getting the vaccine, they called that a breakthrough infection. What Dr. Ardis calls it is your product sucks and doesn't work. That's what it means. It means it didn't do what you said it was going to do, which was going to prevent you from getting the infection, and you got it anyway, or they injected it inside of you. All right, so symptoms related to myocarditis, pericarditis, anything related to the heart, post-COVID, pre-COVID, with COVID, shortness of breath, especially during exercise or periods of exertion. I cannot tell you, thousands of people report this to me, including medical doctors, after getting COVID alone. Difficulty breathing or rapid breathing might occur. Shortness of breath at night is also possible. Fatigue and weakness, obviously, with the reduction in blood flow and oxygen to your tissues. Heart palpitations or abnormal heart rhythms. They call those atrial fibrillations or arrhythmias. Chest pains or pressure. Swelling in the legs and arms due to fluid retention called peripheral edema. You will see that often, especially if there's blood clotting going on in the body. The blood can't flow back up the body and it will just pool in your limbs. Edema is usually the worst in the ankles and the feet. Why? Gravity carries it there. That's why. Lightheadedness, other symptoms due to infection, headaches, body aches, joint pain, fever, sore throat, diarrhea, sudden loss of consciousness, increased risk for heart failure, blood clot, stroke, or heart attack. And we're going to go ahead and say it here. It might be in these slides here in the future, but I just want to make sure everybody knows. If you or a loved one are dealing with these symptoms right now, make sure you request from your medical doctor or go to a lab near you and pay cash for a D-dimer test and a troponin test. Also, it's not a bad idea to get a phospholipase A2 test. Seriously, that's what I would recommend you do. All right, let's go to the next slide. Those are your symptoms related to myocarditis and heart inflammation. Myocarditis has been associated with permanent heart damage and in some cases leads to sudden death, heart failure, heart attack, stroke, and heart arrhythmias. Why does myocarditis cause swelling of the heart and heart failure? It can stop the heart muscle from properly being able to pump the blood, which might cut off blood flow to the brain or other organs. Injury to the heart might also cause blood to pool in your heart and develop into clots. Clots travel through your arteries, causing a heart attack, or travel to your brain and cause a stroke. How many of those have we seen reported around the world? Arrhythmias might also cause your heart to stop beating, called sudden cardiac arrest, which is deadly. And this is a reference found from Dr. Axe's website, who's an incredible chiropractor and has tons of info at draxe.com. All right, possible causes for myocarditis, inflammation of the heart, as published online. Viral or bacterial infections, autoimmune responses, parasites, funguses, snake bites, go figure. Snake bites, adverse reactions to medications, environmental toxins, and heavy metals. I just want you to note something here. Snake bites can do it. Snake bites and venom were actually found to be the origins of COVID. We've already discussed that at length. The venom peptides they synthetically manufacture around the world, if they get into your body, they will have the same side effects as snake bites biting you, which can be myocarditis. Adverse reactions to medications are going to be probably the second most common cause for myocarditis in all of you or your loved ones. For any of those symptoms I just listed for you, you need to look at medications as being the cause. What kind of medications? Blood pressure medications, anxiety medications, antidepressants, all kinds of medications, and vaccines of all kinds. Vaccines are medications, all of them, and they should be looked at and researched to determine, are they possibly the cause for your problems? And then environmental toxins and heavy metals. All right, let's keep going. Venom research, because I love venom. I've become the snake venom guy worldwide. Myocardial infarction after snake bite and venomation, a scoping study. That is a reference. You can click that article and read it. They showed in this paper individuals who are bit by vipers or by venomous snakes. 88% of all the people will have elevated troponin levels, which means there's been death to their heart cells called cardiomyocytes. What's released into the bloodstream from damage of these heart cells due to venom is called troponins. So if you see elevated troponins, all you know is something really bad has happened to heart muscles in your cells of your heart. They have been damaged. The constituents of those cells are now in your bloodstream floating around. You will see them on an elevated blood test. And troponins are being found in almost every long hauler COVID patient and vaxxed injured. But it's found in 88% of all snake bite victims. And it is published in this paper. Males have death of heart muscle, leading to what's called a myocardial infarction far more often than females do when bitten by snakes, which is exactly what we're seeing with athletes around the world, with males around the world experiencing myocarditis and its actual diagnosis after COVID-19 vaccines. Teenage boys, adult males had worse outcomes, way worse than females did, at elevated troponins and myocarditis found by the CDC. All right, another study is cerebrovascular accident and snake envenomation. A cerebrovascular accident is a stroke in the brain. You can actually read about that. Strokes reported after snake bites. After venom's introduced into the body, strokes occur. Why? They cause clotting. They know they cause the clotting. That's what it does. D-dimer research. You can see it actually there on the slide. You can click these links in the presentation. Share with your loved ones. Actually, on this article, it actually tells you that the fifth bullet point, medscape.com, it tells all medical doctors what you should be looking for if you see elevated D-dimers. Elevated D-dimers is what was found by Charles Hoff, MD, in Canada. And this is where the term the clot shots came from, because elevated D-dimers represent the breakdown of blood clots in the human that's being tested. They know the body's breaking down blood clots. What's left over in the blood from the breakdown is what you're seeing as elevated D-dimer. It doesn't tell you where the clots are. It doesn't tell you what causes the clots. It tells you clots are in the body being broken down by a substance called plasmin in your body. Or you're on a drug specifically prescribed to you, intravenously being delivered or orally, called warfarin, Coumadin, or heparin. And those drugs break down the blood clots. And a side effect will be elevated D-dimers if they're on those drugs. Elevated D-dimers, the fifth bullet point on there, is telling all medical doctors you need to look for snake venom poisoning. Every COVID-19 vaxxed injured, every long hauler COVID patients you should have, if you have cardiovascular symptoms like we showed earlier, you need to have an elevated D-dimer test run. And if they are elevated, you have blood clots occurring in your body. What are the antidotes to those? I'll tell you here in a little while. But you need to do that first and find out. And then also there is a published article we left here with a link, myocardial infarction or heart attacks as a rare consequence of snake bites. And we're seeing heart attacks all over the world. Ask the researchers and the cardiologist. All right, next slide. If I can get this to go. Here we go. Pharmaceutical drugs and possible side effects. For most people with cardiovascular disease, high blood pressure, myocardial infarction, or heart attacks, you're going to be put on drugs by cardiologists. These are the drugs that they're going to prescribe you. You have what are called diuretics. Diuretics make you pee. They increase your urination. And loss of sodium, loss of potassium, dizziness, headaches, dehydration, muscle cramps, gout, impotence. These are all side effects of diuretics. Impotence, gout, muscle cramps, dehydration, headaches, dizziness, loss of potassium, loss of salt. There's a published article here, Diuretics and Risk of Arrhythmic Death in Patients with Left Ventricular Dysfunction. Now, a cardiologist with an ECG, EKG, when they do these evaluations, they'll be able to determine which part of the heart's got a dysfunction. If the left ventricle does, they know diuretics increase the risk of arrhythmic death as a side effect. The conclusions in this study were potassium-sparing diuretic was associated with an increased risk of arrhythmic death, whereas baseline use of a potassium-sparing diuretic was not. These data suggest that diuretic-induced electrolyte disturbances may result in fatal arrhythmias in patients with systolic left ventricle dysfunction. So I just want you to be aware there are pharmaceutical drugs they're going to prescribe you that they believe are all going to be beneficial and helpful to you. And there are published drugs to help lower blood pressure that are called diuretics that are published to increase your risk of death from arrhythmias. I'm not sure I would want to use a drug that does that, but here's some examples of a diuretic. Furosemide, otherwise known as Lasix, is probably one of the most common one. There's also another one, another diuretic called digoxin or digoxin. Brand name is Lanoxin. From the abstract, you can see the images on the right. If you're watching this live, if you're listening, you won't see them. But we've got images of the drugs on the right. If you click the link on the screen, you will see a full list of all the side effects of these drugs. Now, I learned from a medical doctor in chiropractic school who was my pharmacology professor. He started out every lecture with this. He taught us drugs. That was his job. That's all he did. Every drug lecture started like this. Everyone in the audience and everyone in the attendance here in this classroom, just remember there are no side effects to medications, only effects. The side effects are what the drug company lists as the unwanted effects of the drug that are not beneficial, that were found in research studies in healthy people. Not sick people they're going to be prescribed for. Only for healthy people were they given. And then they gave these healthy people a pad and paper and said, write down everything that happens to you when you start taking this drug. And they need healthy individuals in the research studies because they need a clean slate with no symptoms, completely healthy people between the ages of 20 and 30 that they can bribe with a payment to take their experimental drug and write down every side effect they have from the drug. So every side effect you read on any paper from your pharmacist or your medical doctor or online, side effects are actual effects of the drugs that the drug company doesn't like, that the person doesn't like, that's going to take it. And they started out giving these to, in human trials, giving them to healthy people 20 to 30 that they knew would take the money to take their experimental drug and then write down all the side effects. So for example, I'm not even doing it here, but there's a drug called Humira for rheumatoid arthritis, psoriasis, any kind of autoimmune diseases. Do you know the very first side effect listed on all drug commercials is Humira is known to cause cardiac arrest and death? That's the first thing they list in their drug commercials on TV. That means in the studies, when they gave Humira to healthy individuals between 20 and 30 who were healthy, some of them took the drug and died. And now you, as an autoimmune or immune suppressed person, they want you to take that drug? I would say no, thank you. How many other companies in the entire world, let me just ask you, if there's a coffee company out there that comes out with a new coffee, some new Frappuccino, and they actually give it to 100 people, what if 3 of them died after they drank that, like within an hour or 2? Do you really think Starbucks or that coffee manufacturer is going to be allowed to sell that coffee in the future? I mean, really? I mean, only 3 people died. You should drink it. No, I don't think anybody should be dying at all, and you should never be allowed to sell something that led to a healthy person dying, or ill person for that matter. All right, so in this abstract here, the use of digoxin is limited because the drug has a narrow therapeutic index and requires close monitoring. Digoxin can cause many adverse events, is involved in multiple drug interactions, and can result in toxicity, which is not helpful in a heart disease situation. Here we go to Primacor, which is an injection. This is actually used also for myocarditis, regulating blood pressure, regulating heart rhythm. These are the side effects they list for this drug. Milrinone is what it's known as. Chest pain, a lightheaded feeling like you might pass out, like when someone has low blood pressure is going to have a heart attack. Low potassium levels with leg cramps, constipation, irregular heartbeats, which is what they're prescribing it for, fluttering in your chest, increased thirst or urination, like diabetes, numbness or tingling, muscle weakness or limp feeling, hives, and headaches. Those are just some of their side effects. Now let's go to the next. Oh, no, not that one. We don't want to go to that slide yet. Why did it go there? Here we go. The most common prescribed high blood pressure drug on the market in America is ACE inhibitors, abbreviated ACE, angiotensin converting enzyme inhibitors. ACE inhibitors, you're going to see the list of common names of those drugs on the screen, and a whole bunch of you Americans are swallowing this every day. In fact, it's upwards of 22 million Americans are taking the 5th one on the list called lisinopril, otherwise known as Zestril. Lisinopril is made up of 2 drugs, a diuretic and captopril, which you see captopril is number 2 on the bullet point there. Captopril is inside lisinopril. Captopril was the first ever patented ACE inhibitor in 1981 by Bristol Myers Squibb Corporation. All these ACE inhibitors you will see here end with the abbreviation pril. Pril, captopril, benazepril, enalapril, fosinapril. The prils are all of them, all of these ACE inhibitors are all derived from snake venom, from a viper in Brazil. That's where all this started. Every single ACE inhibitor drug you see on this list is derived from snake venom. What's my worry with that? Since 1981, captopril was the first. All of these ACE inhibitors share the exact same mechanism of action and are designed off of the ACE inhibitor effects of snake venom. ACE inhibitors are paralytic. They paralyze muscles. Your blood vessels and arteries are muscles too. So if they can paralyze them just a little bit every day, it'll relax the muscles and your blood pressure goes down. There is a horrible side effect, and I will talk about it over and over and over, to injecting or ingesting snake venom, period. All snake venom. In 1956, it was discovered by Dr. Stanley Cohen that all venom in a mammal, or even in the presence of a bird developing as a chicken embryo in 1956, they determined that snake venom has this invisible factor, they called it, since 1956, in a mammal or in a bird will actually cause cancerous growths in the brain in all nervous system tissue, and in every single organ and skin tissue of the human body or mammal. And they call these invisible side effects of snake venom in a mammal or a bird. They call them nerve growth factor for nerve tumors, brain tumors included, and epidermal growth factor, which is anything that has epidermis on it, which is all your organs, all your skin on the outside of your body, any skin cancers, internal organs that develop cancers. Those are epidermal growth factor triggered cancers. I am not okay with anybody swallowing snake venom derived anything or ingesting them or having them injected inside of you when they know the negative effects of cancer growth, proliferation of cells in the body, which is published to be side effects of venom. Anybody you love that's on any of these drugs, I would ask your medical doctor who prescribed it, ask your medical doctor if venom is right for you, because for none of you is it actually okay. Does it have an effect in your body? Yes. I actually just watched a show last week on Netflix. I like documentaries. There's a Netflix documentary right now titled 72 Deadliest Animals in South America. Go watch it. Just came out a couple months ago. Watch it. In that, they actually show you the Brazil viper. They show it as one of the deadliest creatures in South America, and they state in the documentary that this viper's venom, from its venom, 60% of all life-saving drugs, they say, are manufactured from its venom. All of them are high blood pressure drugs or cardiovascular drugs or cancer drugs. So they actually publish it and say it out loud that the pharmaceutical industries are making venomous-based drugs all over the world, and they even consider them life-saving. There ain't nothing life-saving about venom. All right. Just warn your loved ones about this list. If anybody are on them, you should probably talk to your medical doctors about getting off of those. Or maybe improving your diet or using supplements from natural plants that could actually do the same thing without the side effects of these drugs. Let's see if we can get this next slide to come up. Antibiotics are another drug that can have horrific side effects. All right, so side effects of antibiotics: stomach upset, yeast infections, fever, allergic reactions, bleeding, and heart problems are a published side effect of antibiotics. Not sure if you knew that. I'm going to read some of the highlights here from a couple of the linked. There's links here. Click them to go look at the research papers and articles. Titled Antibiotics and Heart Risk. Researchers found that women over age 60 who took antibiotics for at least 2 months during a 5-year period had the greatest risk, 32% of them, of having a heart attack or stroke. How many of you knew antibiotics could lead to heart attacks and strokes? How many of you are living on antibiotics? Women who took a long course of antibiotics in the middle age had a 28% higher risk for heart attack and stroke. Women who took antibiotics for 2 months or longer in their 20s to 30s did not have that risk. All right. So those of you who are in your middle ages, 30 years and older, you have a 28% and 32% chance of having a heart attack and stroke while being on antibiotics if you're on them for at least 2 months. The FDA warns that some antibiotics can cause fatal heart damage. That's the next article. Your chances of developing a severe and potentially life-threatening heart condition can double if you take a commonly prescribed class of antibiotics, researchers found. These antibiotics are called fluoroquinolones, and a new study published this month finds people taking them had an increased risk of developing aortic and mitral regurgitation. How many of you who have loved ones whose valves in the heart won't close all the way and you're allowing blood to go from one chamber to the next, which it's not supposed to do? They call that regurgitation. How many of you have valve issues? And we're also on antibiotics that have a published side effect per the FDA to cause this problem. A condition, they say, that could lead to heart failure. That's awesome. All right, so can antibiotics hurt your heart? And what you should know, absolutely they can do that. They're already publishing that. All right, now let's go to the next presentation here. Where's my next slide? Oh, here we go. Very good. I don't know where they went. I just need to slide this up maybe a little bit. All right, very good. Women who take antibiotics over a long period of time are at increased risk of heart attack or stroke, according to a new Tulane University research study. The study, published in the European Heart Journal, is one of the largest research efforts to investigate the link between antibiotic use and the risk of heart disease and stroke. Researchers found that women aged 60 or older who took antibiotics for 2 months or more had the greatest risk of cardiovascular disease. But long duration of antibiotic use was also associated with an increased risk of taking antibiotics during the middle ages 40 to 59. The researchers did not find the same risk for antibiotic use for 20 to 39-year-olds. So those 40 and older, y'all need to know there's an increased risk of cardiovascular disease, heart attacks, and stroke per the Tulane University, and the links are provided there. I do want to speak to this, though. All of you who have actually been diagnosed with a virus of any kind, influenza, pneumonia, doesn't matter. If you've got a viral infection of any kind, if you go to the CDC's website right now, there's actually published articles on cdc.gov's website that state antibiotics should not be prescribed during a viral infection. Yet every single COVID-19 supposed viral diagnosis for SARS-CoV-2 virus, every single protocol includes antibiotics. Isn't that weird? When the FDA says antibiotics are unwarranted in a viral diagnosis and can do more harm than good. Y'all should reference that study. Antibiotics are not always healthy or beneficial. All right, so what are some natural solutions if you're going to be looking for antibiotics use for bacteria, viruses, you name it? You all know about a product we released a year and a half or 2 years ago. It's called Doc's Viral Defense. You can see it here. You can watch a video here, share this presentation. It's me explaining the 5 ingredients, why it is they're chosen to be in there to help you ward off infections and pathogens during the common cold, flu season, or annual COVID season now that we're being sold. But anyway, this is an opportunity for you to share, educate, and learn. There's 5 ingredients in my Doc's Viral Defense. It's actually quercetin, selenium, NAC, vitamin C, and betaine and hydrous. Those are the 5 ingredients there. And if I misspoke any of those, you can actually look there. But it is zinc, NAC, selenium, quercetin, and betaine and hydrous. Those are the 5. Go there and learn more about that today. If I were you, this is what I take every day, me and my entire family. We made this for us, and now we share it with the world, which is great. And people around the world report to us that during this entire flu cold season of this year, using Doc's Viral Defense daily, none of them ever got sick, which is phenomenal. So this isn't a 100% guarantee in life. Nothing does that. But these vitamins and minerals God put on this planet to support your natural immunity. And there's no risk of antibiotics. I do want to say, though, outside of antibiotic use for bacterial infections, if you're diagnosed with one, like E. coli, Salmonella, Klebsiella, Enterobacter, these are some different bacteria you can be diagnosed with. Food-grade hydrogen peroxide kills bad bacteria everywhere in the human body. Also, it has additional oxygen to it. Healthy bacteria require oxygen, so it helps feed the good bacteria that's in your body. And then the hydrogen peroxide itself provides oxygen that kills anaerobic bacteria, which are the bad bacteria like E. coli, Salmonella, Klebsiella, you name it. The bad bacteria cannot thrive in oxygen, neither can viruses. That's why when you give hydrogen peroxide into the body, that increases oxygen load, and then the patient will experience death of the virus, death of the bacteria that are bad. And then the extra oxygen also feeds the healthy bacteria and helps proliferate more of them to help normalize your bowel biome, your microbiome, your flora, without the risk of using an antibiotic to wipe out all bacteria and then have to go put back in healthy bacteria in the form of a probiotic. Food grade hydrogen peroxide, 35% is phenomenal. Love it. If you want to learn more about that, there's actually a book called The 1 Minute Cure I would recommend. And the author's last name is Kavanaugh. That's what I would reference. All right, CardioFlow is a product that Diamond and Silk did a great job continuing to promote and use. Anything to improve cardiovascular function, CardioFlow has all the ingredients there for you. You can find the links there also to ingredients there when you go and find this presentation online. You can also find the proofs there at thedrardisshow.com of all the studies. Now let's talk about N-acetylcysteine. We're going to talk about this for a minute. The FDA decided in May of 2020 they were going to stop allowing supplement companies after 75 years to be able to sell N-acetylcysteine anymore. There is to the right on this screen supportive research study links, and you can read those. This actually, the first study, if you read it, the conclusion is NAC by itself helped to improve cardiovascular function even in diabetics. So NAC is extremely beneficial. Why would I recommend this in a period of time during this pandemic and for the future forevermore? N-acetylcysteine is proven to help break down blood clots in the body, which you are having. Everyone on the earth right now is being injected with or threatened with poisons, toxins, or venoms. They know and initiate rapid blood clotting. And that has been a serious side effect of COVID, a massive reported side effect post getting the COVID-19 vaccines. So should you make N-acetylcysteine a part of your daily life? I do. I would if I was you. So I use N-acetylcysteine knowing the FDA was going to try to strip it is when I reached out to our own manufacturers to make sure we had it in stock for our audiences to try to protect them at home. How much do I recommend? If you don't have any symptoms, I would recommend 500 milligrams a day. If you have symptoms, long hauler COVID symptoms or vaccine injury, you do an elevated D-dimer and troponin, all of you should be on 2,000 milligrams of NAC until you see that go back to normal. 2,000 milligrams a day is what I'd recommend. And you can get that at thedrardisshow.com. What else? Magnesium. Magnesium is extremely beneficial. I've already done multiple shows here on magnesium. If you haven't seen, about 3 years ago, I did a whole show on 15 diseases and 15 symptoms that are solely caused by magnesium deficiency. If you actually go to TikTok, this is not a joke. Everywhere I go, I'm called the TikTok doc. Like, oh my God, it's you. You're the celebrity doctor on TikTok. I've never even put anything on TikTok. It's really funny to see people around the world recognize me as such. But there are millions and millions of views of me online. I'm now called by lots of people that see me and want pictures with me that I'm the magnesium doc from TikTok. But anyway, there's been massive amounts of information going around the world on TikTok, and all your young audiences are getting it too, which is great. Supportive research and links here for magnesium. I think everyone here should know that magnesium is extremely beneficial in 300 different mechanisms in the human body. Over 300. That's how great magnesium is. What's the regular dose for magnesium? I'm going to speak to this separately. If any of you are having tachycardia issues right now, after having COVID or AFib or arrhythmias, if any of you have been diagnosed with congestive heart failure after getting the COVID-19 shot or getting COVID-19, I need to speak to you for the next 3 months. If you have any of these issues with your heart since getting COVID and since getting the shot, if you got it, which is fine if you did, we're going to try to save you anyway. You need to stop magnesium for the next 3 months. Anyone else on the planet needs to continue magnesium every day for the rest of their life to prevent congestive heart failure, osteoporosis, insomnia, you name it. Magnesium is that brilliant. And you can see a list over here of the 5 or 6 different research studies we have linked here for you to go in and learn about the benefits of magnesium. At bare minimum, everyone else should be taking magnesium every day at 500 milligrams every day. There is a specific formula if you want to know how to be really good with magnesium. Take your weight, divide it by 2.2 pounds, multiply that by 10.6 milligrams, and that will give you your daily milligram dose your body requires of magnesium for the rest of your life. All right, quercetin, which is actually inside my doc's viral defense. Quercetin, if you listen to Zev Zelenko, which I love that guy, and God rest Zev Zelenko and bless his family with their loss. Quercetin is actually the substance found in nature in the rinds of fruits, colorful fruits, and vegetables that they used, pharmaceutical drug companies did, to make hydroxychloroquine. And if you learn from Zev, he said hydroxychloroquine was like the gun that would shoot the bullet into your cell to protect you from COVID. The bullet was zinc. Quercetin he called a zinc ionophore, along with hydroxychloroquine and ivermectin. Quercetin is all natural. You guys know I love all natural stuff. Quercetin is what I use and prefer. That's why I take Doc's Viral Defense every day. Quercetin, I've done complete shows on this and did videos on this product. You can go to our product page and learn more about it. But quercetin's been shown to actually lower cholesterol 5 to 15% within just 6 to 8 weeks of use every day. And it's also been used to reverse high blood pressure. So I've done those presentations, and you'll see to the right, there's some of the supportive research links to why it is I recommend quercetin every day, why I take it every day. Therapeutic potential of quercetin as a cardiovascular agent for the heart. There's one study, effects of quercetin on blood pressure. You're going to read about it there. Improving blood pressure. A role of quercetin in coronavirus 2019. Obviously, we just talked about that. The biggest benefits of quercetin, health benefits of quercetin, what's quercetin and its benefits, where's it found in foods, and the anti-inflammatory potential of quercetin in COVID-19 treatment. So these are just some of the references. There's a lot more, even at the Dr. Ardis Show on our site at the product page for quercetin. And then let's go to another one for heart health is zinc. I will never, ever stop taking zinc, ever. Zinc deficiency and cellular oxidative stress. Zinc deficiency absolutely is implicated in cardiovascular failure and issues with cardiovascular disease. Zinc deficiency is a biomarker for cardiovascular health. Healthy levels of zinc are also a positive marker for cardiovascular health. So zinc is very, very important. Zinc, I will tell you now, zinc by itself is antiviral. So during periods of common colds or flus, zinc would be something you want to make sure is going into your body every day. Also, I'm not sure if you know this, all you females and males in the world, if you have any loved ones who have been told, or you yourself has been told, you inherited cancer from your loved ones. It just runs in your genes. Ma'am, you're going to have breast cancer most likely because your mom or aunt or grandmother did, or your sister did. Boy or man, you're going to have prostate cancer because your dad did, grandpa did. Those are all lies, by the way. If your parents taught you and educated you how to eat, how to take care of yourself, you probably and most probably took with you into your adult life the same habits they taught you. It's not that they're genetic. You just happen to have the same habits dietary-wise they do. And if they were zinc deficient, you're going to be zinc deficient. If they were B deficient, so are you. You're going to be adopting, most of you, the same eating styles and habits as those you raised in or were raised in their same home. So zinc deficiency, I just want to point this out. Zinc is extremely beneficial when it comes to keeping you healthy and boosting your immune system. It's also very beneficial with the heart. I'm not sure if you're aware of this. Estrogen dominance, which is the number one correlated hormone dominance leading to every breast cancer diagnosis, cervical cancer diagnosis, ovarian, uterine, all the female cancers, and every single prostate cancer ever diagnosed in a man are correlated to estrogen dominance. Too much estrogen. Do you know that a zinc deficiency drives estrogen dominance? If you do not supplement zinc, you will increase estrogen, which will make you more prone to cancers. So if you increase zinc intake, and I'm telling you, I've done tons of research on zinc just to manage hormones to improve acne, cystic acne, cancer outcomes, you name it. Zinc, it is recommended by the FDA 20 to 30 milligrams a day. No. Research studies show 100 milligrams a day is going to be the best amount to keep your estrogen and hormone levels in balance. You can actually consult with your medical professionals, obviously. Take your zinc levels, make sure you're getting enough and have enough of a normal range in your blood work. Zinc, I recommend 100 milligrams a day, and I take 100 milligrams a day. Why? I don't want prostate cancer. I don't want estrogen dominance, ever. Not today, not in 20 years. I want to be able to pee without dribbling. I want to not have to wake up in the middle of the night and have to go pee 5-6 times. Men, you should be on zinc. All of you, especially after 40. That's why I actually made a product called Prostate Pro that's not a part of this presentation, but when I turned 40, every time I'd go to urinate, I would dribble. And then I was waking up 3, 4, 5 times a night to pee, which was weird. And I decided to formulate my own prostate product, contacted a company to do it, and I took my own product for 4 years. Actually, we're in the 6th year now. But I just want you to know, within 2 weeks of starting that product, I never woke up again. And I never had any dribbling anymore. And I'm just going to continue to take the products that feed me, and zinc is the primary component of that. That's why zinc is so important. Let's go to selenium. Selenium, you'll find it at the Dr. Ardis show too. You'll see several studies here just in relationship to health, heart health particularly. In the published article, 7 science-based health benefits of selenium, they mentioned cardiovascular health, the impact of micronutrients, calcium, vitamin D, selenium, and zinc in cardiovascular health. That is a small review. Please go there. Selenium tells your bone marrow to make white blood cells also and supports your immune system. White blood cells are your antibodies to fight infection and repair damaged tissue. Everyone needs to be on selenium. Also, selenium, and we've done shows here just about selenium. Selenium can be taken from 200 micrograms a day, which is what's in one of our capsules, up to 1.2 milligrams, which is 6 of those. 200 micrograms is what you will see typically recommended by the FDA and other supplement companies. That's what's in our bottle, but you can take up to 1.2 milligrams every day, which is 6 of those every day, based on your health. A bare minimum would be 200 micrograms a day. Also, for those of you in the world that have hypothyroidism, all of you are selenium deficient. You need to be on selenium. Selenium is required to make thyroid hormones. Natural solutions to cardiovascular health. You're going to see a list here on the screen. Astragalus, CoQ10, curcumin, glutathione, green tea, hawthorn. I've actually used every single one of these in practice, depending on what the scenario was and the patient I was dealing with. All of these are all natural products. Astragalus, astragalus is an herb or a plant. CoQ10 is coenzyme Q10. Probably the most researched enzyme, period, on the planet for heart health. And you can get that anywhere on the planet. I don't sell it. Glutathione is made by the liver. Most powerful antioxidant we have. If we're ingesting vitamin C, that's super powerful. Glutathione that the liver makes in your body is even more powerful as an antioxidant. Selenium, NAC, and apple pectin powder, together when you ingest them, the liver can make more glutathione from those components. Green tea, obviously beneficial and healthy. Hawthorn is a plant. It is a plant extract. It comes in capsules, tablets, standard process, and MediHerb has a great product of hawthorn I've used for years to help with high blood pressure, arrhythmias, in the process over months to a year to reverse congestive heart failure or improve heart and cardiovascular function. So those are some products that you can learn about. Here's some additional research links for you guys to follow and read about COVID-19 and its correlated effects to the heart and heart in any heart condition, period. Here's our disclaimer. You should always consult those that you respect and those that are prescribing and overseeing your health. This is information, research studies you can download, print, link, and share with your loved ones and with your healthcare providers. And you should. None of the statements I've just made, nor any that I ever make on my show, are actually approved or evaluated or reviewed by the FDA. Nor do I care. Nor do I want them to be. I don't trust them anyway. But I want to make sure that disclaimer is there so you know. Anyway, I am Dr. Ardis. This is the presentation on heart health. We want all of your hearts beating perfectly and into the future. One of the things you're going to see coming from me over the next months, years into the future, not only will we be providing you education on materials and supplements that will benefit your body, the risks and benefits to medications that exist for your conditions or your loved ones' conditions. We also want to build into this platform, and we will, and I've already found people to help me. We're going to be building out recipes, foods, meals that are specifically targeting to improve whatever aspect of health we're going to be addressing. And it's going to be very exciting. And I'm going to announce right here, I didn't think I was going to do it, but might as well let you know. There's going to be a new club coming, a membership exclusive club called the Ardis Club. The Ardis Club Experience, we'll call it ACE for those of you who guys decided to call it. You'll all be ACEs, Ardis Club Experience. All right, for you members, we're going to actually build out on my website for the Dr. Ardis Show, something abbreviated ARDIS for my name, ARDIS. But there will be periods behind each one of those because each of those letters are going to stand for something. And that whole section is going to be for Ardis revealed drug-induced side effects. And every drug you can think of, we're going to list out there in alphabetical order. And as we're doing our research for month awareness health topics, we're going to pick the most prescribed drugs in those, and we're going to build them into that platform so you guys can easily find and reference on the drardisshow.com's website. You can go to the ARDIS section, the Ardis revealed drug-induced side effects. We're going to list out for you what my concerns are that are published about the drug side effects in your body. And remember, as Dr. Perryman taught me in chiropractic school 20-something years ago, there are no side effects to medications, only effects. And not all of them are beneficial. The majority of them are toxic and deadly and disease-causing. I'm Dr. Ardis. God bless you. We hope you enjoyed the presentation. Please share far and wide. We look forward to hearing testimonials from you. And please share away at info@ardislabs.com. God bless you. I'm Dr. Ardis. We're out.